Hey guys, what is up? Welcome back to my channel. So today we're going to be talking about MD versus DO, comparing and contrasting the two and seeing which one is a better fit for you. As always, before we get into the video, make sure to go down and hit that like button, and if this video adds any value to your life at all, make sure to subscribe. I do make new videos just like this one as often as I can, so make sure you don't miss a video. I know that this can be a sensitive topic, at least for my school, and at my school it is definitely a very sensitive topic. Those going DO versus those going MD. So for this video, I'm just going purely based on statistics, just numbers. None of this is my personal opinion. And at the end of the day, MDs and DOs are both qualified doctors, and they are both fully capable and qualified to see and treat patients. So the first thing that I'm going to talk about is kind of what are they? What is the difference between MD versus DO? What does it mean? What do they do? And what's the difference in their training? So for those of you who don't know, DO stands for Doctor of Osteopathic Medicine, while MD stands for Medical Doctor. The main difference between these two is actually just a few slight differences in their training to become a doctor. But in terms of the end result, you can have an MD or DO orthopedic surgeon, you can have an MD or DO emergency medicine doctor, MD or DO anesthesiologist, family medicine. It doesn't matter. The letters behind your name don't necessarily determine what kind of doctor you can be or what you can practice and what you can't practice. So in terms of schooling, DOs will go to a DO medical school, while MDs will go to an MD medical school. For a DO medical school, they are basically almost the exact same as an MD medical school with a few slight changes, some of those being the way that they view medicine as well as some of the placement tests that they take during medical school. DOs usually tend to opt more for old Chinese medicine. They usually tend to be a little bit less invasive than their counterparts MDs. If you actually look up what the word osteopathy means, the exact definition is osteopathy is a system of alternative medicine that emphasizes physical manipulation of the body's muscle, tissues, and bones. Now, I will say in the modern age of medicine, doctors of osteopathic medicine are not going to be against surgery, they're not going to be against using medications or going a more modern route. But during their medical school training, they're also trained in the ways of osteopathy. Another difference, guys, is during their training, they will actually take different placement tests. The medical doctors in the MD schools will actually take the USMLE step tests. It's a series of 3 tests, step 1, step 2, step 3, while doctors of osteopathic medicine will take a test that's similar to this. Their version of this test is called the complex test. At the end of the day, both DOs and MDs are both trying to do what's best for the patient. So if that does mean surgery, DOs will 100% go for surgery. If that means maybe some osteopathy or less invasive forms of medicine, MDs will definitely still go for that. Those are just kind of the differences in what DOs are versus MDs. Okay guys, so the second thing that I do want to talk about are just some statistics on MD versus DO match rates. There are a lot of people at my school, a ton of pre-meds, who say it doesn't matter if you're DO or MD, you can still do whatever you want, you can still get into whatever residency you want, and it seems to hurt people's feelings when I say this just simply is not true. I'm going to base this completely off statistics. As I said before, the fact is, especially if you want to go into a competitive residency, it is just easier to match if you're MD versus if you're DO. First guys, I'm going to go over the overall match rate of MD versus DO. This means in every single specialty in the country. The overall match rate for MDs is around 93%, while the overall match rate for DOs is around 91.5%. While you may be thinking, James, that's not even very different. Yeah, MDs are a little bit higher, but it's like 1.5%, who cares? This is just the overall match rate. That means the less competitive specialties and the most competitive specialties. If you are wanting to do a competitive specialty, these numbers change drastically. I'm going to show you guys a study that was done on the matches of DOs and MDs for these competitive specialties. These are obviously not every competitive specialty that's out there, but these are just 7 that they did for the study. So the specialties were neurosurgery, thoracic surgery, plastic surgery, general surgery, vascular surgery, ENT, and orthopedic surgery. If you are a US MD senior and you applied one of these specialties for this study, statistically your chances of matching was a 73.61%. If you are a US DO senior and you applied to one of these specialties, the chances of you matching is a 52.89%. So guys, the data is there. If you don't really care about going into a super competitive specialty, obviously this doesn't matter very much, and it doesn't matter if you do DO or MD. But if you do want to do a competitive specialty, statistically you are much more likely to get into it if you go the MD route. Obviously guys, the reason for this discrepancy is not because MDs are smarter than DOs or because DOs are less of doctors than MDs. They both do a great job and they can both fix you up. Here in my town, I know a couple of orthopedic surgeons who are DOs, so I'm not saying it's impossible. And these orthopedic surgeons do a great job. They're statewide known. But I think if you guys do know the information, you'll have the best chance at getting into the specialty that you want. Okay guys, so the third thing that I'm going to talk about is the statistics to get into a DO school versus an MD school, because just like residencies, these statistics are also different. Based on the numbers, it is just easier to get into a DO school than it is an MD school. I talked to my pre-med advisor for this video and I asked him my college's data for last year for those who went into MD school versus DO school, what their average GPA was and what their average MCAT was. There are a ton of different statistics that you can find online, so I didn't know exactly what was accurate and what wasn't, so that's why I just went with my one school. The average GPA and MCAT score for those going into MD was a 3.81 and a 511 MCAT score. And those are the students who matriculated into MD, not just those who applied. The same thing for DO. For GPA, it was 368 and a 508. There are a lot more statistics and facts on this sheet. I will put it up here and you guys can pause the video and just kind of look at it. But obviously, as you can see, it is much easier to get into a DO school than it is an MD school statistically. Now guys, you also have to keep in mind extracurriculars. I've not accounted for any extracurriculars. This is just based on GPA and MCAT score. While extracurriculars can help you and save you immensely, that does not mean that they can save you if you have a super low MCAT or super low GPA and you want to get into a good school like Duke, Harvard, something like that. The medical school admissions committee member that I talked to at UW, University of Washington, told me that if an application comes across their desk that has an abnormally low GPA or MCAT score, or much lower than what they usually accept, they won't even look at the extracurriculars and they'll just throw out the application altogether. So don't listen to what some people say. GPA and MCAT score are still immensely important in applying to medical school. Okay guys, so the fourth thing that I do want to talk about is how do you decide between MD and DO school? So there are a couple things that you really need to look at, and first of all, you really need to be realistic with yourself and the stats that you personally have. If you have a 3.45 GPA and you're wanting to apply to a school like Harvard or Stanford or Yale, whose students that matriculate average a GPA of around 3.9, that's obviously not realistic, guys. And unless you guys have the most outstanding extracurriculars, like you built a school in Africa bare hands and you funded it, or something crazy like that, it's just not a realistic school for you. So guys, something that I've done and something that you can do is you can actually go and see last year's average matriculated students for every single medical school in the United States, MD and DO. Compare your GPA to these average GPAs from these medical schools. If last year UW had an average matriculated GPA of 3.75 and let's say you have a 3.7, 3.72 around that area, that's probably a good target school for you to try to get into. But if you're in the 3.5s or 3.4s and you're trying to apply to a school that average matriculated GPA last year was a 3.8, that's probably not a realistic target school for you. Now, how does this apply to you choosing MD versus DO? MD schools just usually have a much higher average matriculated GPA than DO schools. So you just need to look at your own stats and your GPA and go to the average and see, can I get into an MD school? And if you can, then why not? MD schools are cheaper, they usually have better connections, and they may keep your options open if you ever do decide to go into a competitive specialty. Another thing to help you guys decide also, obviously, what specialty do you guys want to go into? Me personally, I want to do orthopedic surgery, which is a very competitive specialty, so that's why I'm going for MD. I also just want to say, guys, if you have to go DO, there is nothing wrong with that. You can still do orthopedic surgery as a DO. You can still do plastic surgery as a DO. Even though, yes, it will be harder to get into those specialties, you can still do it. You just need to work harder while you're in medical school. Make sure that you're at the top of your class. Make sure that you're reaching out and making those connections. I hope this video was informative for you guys and kind of helped you decide a little bit more and gave you a little bit more information on which medical school you want to apply to. If you enjoyed that video at all, make sure to hit that like button. And as always, if it added any value to your life at all, make sure to subscribe. I do make new videos just like this one as often as I can. Well, thanks for watching, guys. I'll see you next week.